Madame, monsieur, bonsoir. Mon nom c'est Alain Salon et bienvenue sur Face à Face. Aujourd'hui, nous avons une émission assez spéciale. Assez spéciale, je dis bien assez spéciale, parce que nous gagnons dans ce studio là un mental health counselor et un psychologue. Je dis, nous allons parler de différentes maladies qui existaient au niveau de Timoun qui l'école pas bon ici. Spécialement, nous pas le focus sur la communauté haïtienne parce que nous avons difficulté des fois pour nous accepter que Timoun ça a une maladie ça et maladie ça faut que gagne professional help. Eh bien, avec nous aujourd'hui, nous avons Rachelle Salomon qui est un psychologue également. Nous allons faire un petit chita parler ensemble avec Rachelle pour nous capables d'éduquer et former également communauté haïtienne. Madame, monsieur, encore une fois, je vous présente Rachelle Salomon. Rachelle, comment est-ce?
Très bien, merci. Merci de m'avoir invité. I feel very special and privileged to be able to be here with you today.
Thank you for you, because you said yes to my invitation without hesitation. And you said, oh, Alan, you know, I'll do everything for you. So.
It was quite an opportunity to be able to educate my community.
Thank you once again. Well, Rachelle, alors, nous allons commencer?
Yes.
Moi, je te connais également en tant que professeur, Rachelle.
Yes.
Tu étais professeur de mathématiques pendant assez longtemps.
12 years.
12 years, right? So more than a decade. So what was the previous life? Was it easy as a math teacher? Because you were in Miami-Dade, right?
Miami-Dade, yes.
Mm-hmm.
I was a math teacher, classroom teacher for about 12 years. Well, teaching is never easy, but of course, it's a very rewarding profession. Mm-hmm. And I know people are probably thinking, you're just being politically correct, but it truly is a rewarding job, and I enjoyed every minute of it. I sure did. I really did.
Rachel, qui ça te pousse pour devenir professeur? Tout d'abord, qui ça te pousse? Parce que, bon, nous n'aimons pas parler de carrière en Haïti. Est-ce que tu es professeur? Parce que nous connaissons quitté Haïti de très tôt. Parlez-nous un peu de ça avant que même nous rentrions dans le sujet ça.
I had no plans on becoming a teacher. I was going to be an entrepreneur, a corporate person, until I did a study abroad in South Africa, and they asked me to teach English to underprivileged children, and I fell in love, and I couldn't think of doing anything else. And I came back to the States, even though I couldn't get myself to actually be a teacher because everyone's telling me, so I said, okay, fine, so I won't do that. So I did try the corporate world for a few years, but then my heart kept going back.
So you didn't like it, or what was that?
The corporate world?
The corporate world.
Well, I liked the money for sure.
Mm-hmm. But it wasn't as rewarding as being a teacher in Miami-Dade. But well, I'm going to come back to Miami-Dade County because this is, you know, when we met.
Exactly.
I think it was 15 years ago in Miami-Dade County. And then since then, so it was a long time, right? Yes. Okay. Now, parlez-nous un peu de carrière en tant que professeur, des moments que, par exemple, au Pape Jamblier.
Le moment que Pape Jamblier, c'est when you have students who clearly is struggling beyond just learning math skills, and no one is really investing in figuring out, is it math problems or is it something else? And myself, as a classroom teacher, I didn't have the training to really figure out, why is it that you're not learning this math? Mm-hmm. Why aren't you retaining this information? And then when you go to someone else or when you have a meeting with the parent, the word, my pet peeve, when mom says, "Tetli du, c'est sotli sot, ou bien paresseux."
Is it true, Rachel, parce que moi-même, en tant que professeur, je connais que dans plein de monde qui dit que tout le monde peut apprendre.
Absolument.
Peut-être dans le style quoi pas apprendre. Timoun non, les gars doivent pas assez réceptif que on l'autre. Il y a Timoun qui s'est tendé, il y a Timoun qui est assez visuel, mais ou même en tant que professeur de mathématiques, l'expérience qu'on fait avec Timoun qui spécialement montrait des lacunes qui est assez criantes. Comment on fait pour remédier avec situation ça dans nos salles de classe?
That's when the job of the psychologist becomes important, because if you're teaching a child and you're providing intervention, one-on-one, tailored intervention, and the child is not picking it up, this is the part where you decide to do testing. You start evaluating so that you can find out exactly what is your learning style. And at that point, you create a tailored educational plan for that student.
Was it always easy to do, to tailor a plan for each and every student in your classroom? I know it's not easy. Probably you want to focus on a group of students, but every single child in your children or students in your classroom, right?
there's this magic word that we use in the classroom. It's called differentiated instruction.
I love hearing that word. I love it. I love it so much.
So we create groups of children where we put them together according to their abilities, because they're bound to find another child in the classroom who's learning the same way they do or who share certain similarities with them. So you group them, and in that way, as a teacher, you move from one group to another, and you try at that point to focus on groups of kids at a time, and then you monitor them that way. It's not easy, but it's possible.
Do you have time to do all of that in a classroom?
After a while, once you become a veteran teacher, it becomes second nature. You can do it.
And what about the students? Can you tell me, if you do differentiated instruction for, let's say, once a week or twice a week, do you see the result? Do you actually see the results?
Differentiated instruction is every class. Every class. So your classroom is set up in groups on a regular basis. And you know
every single period?
Every single period.
Oh.
Yes, sir.
Wow.
Yes, sir.
Wow.
Yes, sir.
Le fait que vous dites des professeurs, they wear many hats, that is really true.
Yes.
Bon, m'bable dit ça me fait moi-même parce que tout le monde ouais que m'a essayé avoid that, effectivement, besoin faut parler. But, Rachelle, de très souvent, capable en fin d'année, il y a des petits monde, même le travail ensemble avec eux depuis le commencement d'année jusqu'à ce qu'on arrive dans fin d'année, ou pas vraiment senti que ou à fond travail en tant que professeur, au dire des professeurs que je connais effectivement, avec expérience que je gagne ensemble avec eux en salle de classe. Est-ce que ou même ou jeune ça every single year, c'est chaque année jeune même problème ça, est-ce que il y a des petits monde vraiment vrai qu'on pas capable d'aider?
Absolutely, absolutely. We are all very different from each other. Everyone in this world learns a different way. So there's always going to be this one kid or these other 2 or 3 kids.
Or little Bobby.
Right.
Always, right?
Like, I've been teaching you this all year. You're not quite picking it up. And this is what I mentioned earlier. This is when you look further. You said, okay, you know what? I don't think it's a math thing. Mm-hmm. I think something else is going on. Then you request stronger intervention. Then you bring someone in. You look at intellectual disabilities. You look at learning problems. You look at emotional issues. Because quite sometimes our children are not performing.
And social issues sometimes as well.
Social,
emotional. Yeah. Et son bagay que m'kwe mami did, yo parle ça en pile, et même des classes que yo mette qu'on y a la social emotional learning, you know, de telle sorte que yo capable aider ti moun yo apprendre beaucoup plus vite.
Yes.
Et peut-être beaucoup plus bien pour capable toucher yo en ce sens pour capable améliorer. Mais gon l'autre aspect qui est assez important encore que nous t'a supposé signaler, c'est le fait que il y a des petits moun yo gagné de graves problèmes la caillou. Et problème que yo gagné la caillou, sometimes they need an adult. They want someone that they can talk to. And des fois, c'est professeurs que jeunes, ces professeurs sont professeurs qui very open, you're capable open up to the teacher. And sometimes it's the counselor, sometimes it's an administrator that is in the building, and sometimes friends. So what do you recommend, for example, if you're a parent and you have a child at your house and you know that your child or your children, they have that issue, or you have issues, you know, in your home, and you cannot handle the pressure of your house the same way you cannot handle it. So the kids as well, they can't handle it. And then sometimes they act up in the school. So what can you say to the parents? What can they do to help these kids besides talking to them? So, est-ce que vous t'a recommandé que vous-même vous allez directement dans l'école et expliquer effectivement what's going on in the house, talk to someone at the school just to help this, because c'est comme d'adjo, sometimes some parents, they don't want the flag at the beginning of the school year, so I don't want my children to be flagged and then people commencer à dire que n'est pas bon. So so qu'a dit.
And I can appreciate that. This question is multifaceted. There are so many things you want to look at. So as a parent, if you fear that the difficulty is emotional, by all means, contact a mental health counselor in your community and have your child seen by someone privately. That can be your first step if you're able to. Je
ne veux pas faire l'avocat du diable, Rachelle, mais également, on faut arrêter beaucoup plus sur notre communauté, parce que notre job maintenant, c'est d'éduquer la communauté haïtienne. Maintenant, Ou son parent, par exemple, très souvent ça arrivait, ou bien des parents qui rentraient peut-être il y a 1 année, 2 ans, 3 ans, 4 ans. Et au point, il est assez difficile pour Haïtiens pour l'y intégrer, pour plusieurs raisons que nous pas mentionner. Pas vrai? Il est très difficile pour l'y intégrer dans la société, qui est aussi difficile. Et maintenant, pour mon ça, gagner information, ça, pour les disponibles, dans le même, n'est pas vraiment facile. Maintenant, qui sont capables de dire aux parents comme ça, si toutefois, ou arriver face à une situation pareille, et au senti qu'on a besoin d'aide, ben, ou par contre, qui côté pour aller?
OK. So, si vous êtes parents, vous sentez qu'on a besoin d'aide ou par contre côté pour aller, l'école là t'a supposé premier côté que vous allez pour demander aide. Parce que l'école là, c'est pas seulement, l'école, schools have changed. We're not only teaching kids reading, math, and science. We're catering to the whole child now. So, l'école là, c'est premier point de contact, for sure. But at the same time, en pile parents, yo soucieux de porter problèmes personnels yo by l'école là. C'est ça que fait me dit avant, c'est mieux de trouver quelqu'un in your community where you can reach out to for mental health services. In any case. So you have Vanessa, for example. Vanessa is 10 years old, right? Vanessa's angry. She's not doing her work. She's, failing everything. And Vanessa's moping around and you know something is wrong, right? And of course, many of us will start, spanking, the placebo, that's not working. So you really need to look beyond just this child being belligerent or this child just being lazy. You got to look at other things. So go to your school counselor and explain to them, this is what's going on. What can you do to help me with Vanessa? So that's what I would suggest. And of course, since we are educating, now you know that even if you're on Medicaid or if you have some other private insurance, they will cover services for you to see a mental health counselor.
En tant que professionnel, est-ce que vous pensez que c'est une situation qui gagne pour le revoir avec la situation économique des parents haïtiens ou encore est-ce que c'est le fait qu'il y a joué l'ignorance?
I don't think anyone purposely want to be ignorant. At least I would hope not. But many times our parents are not making decisions because of lack of information. So this is where your show becomes quite a resource for parents in our community. So socioeconomic status does play a big role, right? A big role in the way parents make decisions and how they go about making certain decisions.
OK, n'a font extrapoler qu'on y a là n'a toujours été dans le même sujet éducation et comment pour parents capables de veiller des fois et pour moi-même Rachel je pense que c'est une sorte de laxisme qui gagne là les parents haïtiens autour ou on manque de surveillance qui gagne parce que gagne des petits monde que des fois ou gagne doit ouais que gagne un cancer ou encore l'école là essayer d'identifier que tout le monde ça sont tout le monde qui gagne un learning disability que il pas capable d'apprendre et des fois c'est pas ça c'est peut-être tout le monde là intérioriser là avec un problème que le gagne la caille au ensemble du là qui fait que quand il y a là le arrivé dans l'école là il pas senti que il est capable et intégrer dans le groupe ça vous comprenez. Donc, en ce sens, again, qui ça que nous capables de faire pour parents ça autour parce que yo pas connaît qui ça qui passé en réalité dans l'école là. Si mon doit behave a certain way at home, but in the school is a total different. It's a little monster. Okay, so est-ce que vous recommandez que parents peuvent keep an eye on the school and on the kids as well?
Absolutely, the child is your responsibility. You should always,
not the school responsibility. Let me say that again.
Thank you. The child is the parent's responsibility.
First and foremost,
Governor DeSantis recently passed a bill where he says that the children are the parents' kids, not the schools, not the government. The children belong to their parents. Therefore, yes, we are asking that as a parent, you pay close attention to the way your child is developing. But once again, you mentioned something very important. Are they not keeping an eye on their children?
That's what I was about to say.
Socioeconomic status many times plays a factor in how much of an eye can a parent keep on their children.
Especially if you have 2-3 jobs.
Thank you. And sometimes they're doing the 2-3 jobs because they have to.
They need
to pay the bill because the one job cannot provide as efficiently as they would like for them.
Ils pas veulent faire l'avocat du diable en réalité. I just don't want to be the devil advocate. But I really think that although you're really busy as a parent, I know you're busy, you have one job or two jobs, or you're 9 to 6, and then the other parent sometimes goes to work. So in the afternoon, they really don't have time to make sure that your responsibility, your kids, they do what they're supposed to do. But même pas de temps, Rachel.
You have to find it.
You still have to find the time. All right.
You have to be there for them.
Voilà, on a le timer. Oh, maman, le temps passe très vite. Ça, c'est la première partie. C'est la fin de la première partie jusqu'à présent. Donc, on va observer, madame, monsieur, une toute petite pause et puis on a retourné un petit moment encore avec cette conversation ô combien intéressante avec notre invité d'aujourd'hui, Rachelle Salomon. Une pause, à tout de suite. Madame, monsieur, nous sommes donc de retour après cette toute petite pause. On a continué la conversation nous ensemble avec le psychologue du jour, Rachelle Salomon, qui gagnait Practice Paltou lui-même, et il peut parler nous un peu de Practice les. Mais bien avant que nous rentrions là-dedans, un sujet qui est assez intéressant, et me connaît que gagne pile parents qui prétendent que nous attaquer sujet ça. C'est ti monde qui gagne problème pour yo apprendre, et nous même dans la communauté haïtienne, non tout ti monde qui gagne problème à apprendre, c'est diable qui a mangé yo. Si c'est pas diable, son monde dans famille qui a fait un bagage, alors que gagne plusieurs maladies qui existent, gagne ti monde qui est autistique, qui est dans Miami-Dade County, right? Gagne ti monde qui gagne Tourette syndrome, gagne ti monde qui gagne mental health issues. Rachel, parlez-nous un peu de tout maladie ça, comment pour nous t'a fait pour nous capable détecter de très tôt pendant que Timoun yo l'école, et qui ça nous capable faire en quelque sorte pour aider Timoun ça à avancer dans le domaine dans l'éducation, pas bon ici.
Absolutely. Well, unfortunately, we wouldn't be able to list every single condition, mental health condition.
Donc très souvent nous rencontrons autistique, la situation autistique avec peut-être Timoun Tourette syndrome.
Perfect. So the key is early intervention. You have a young child and you're noticing that he's about 2 years old. 2 years old is not baby. So if he's not babbling and saying certain words and talking a little bit, you need to look at this very closely. You can start monitoring as early as 18 months. You have an 18-month-old who's not babbling, who cries for everything and doesn't try to use certain words to address what they need. You need to further look into this.
Est-ce que c'est ça seulement qu'on suppose regarder? Ou est-ce qu'il y a l'autre bagage encore?
These are the primary indicators.
Okay.
And your first point of contact is your pediatrician. So when you go for your pediatrician visit, make sure you mention it to the doctor, and then so they can refer you to where else you need to look into, whether it's a speech and language pathologist, or whether it's a child psychologist or an educational psychologist.
At that point, it's not a mental issue.
At that point, it's not a mental issue. It's a pervasive developmental disorder at that point. But if you neglect it, it stems into a mental issue. Absolutely.
Okay.
Now, if there's any takeaway that I would like for les auditeurs is that mental health issues are real. It happens to any of us.
Okay.
I want you to destigmatize mental health issues. It happens. Sometimes within a moment, something goes wrong and we snap, and then we lose touch with reality. And it is important that you see a mental health counselor, that you see a psychologist. Having a good psychologist is the equivalent of having a good lawyer. You never know when you're going to need one, right? It's important. Mental health, hygiene. The same way you eat well, you exercise, you need someone to help you with your mental health conditions also.
At what age can we tell if a child is mentally ill?
18 months.
18 months. That early.
That early.
So, nous pas parler de un petit monde qui a un problème de développement, non, là. M'a parlé d'un petit monde qui gagne un mental issue. So, un petit monde qui gagne, okay, par exemple, on prend autistique, là.
Autism, for example, you notice that your 18-month-old is not speaking. If you want, because by 12 months, they know the bottle, they know milk,
Yo qui doit pas qu'à prononcer effectivement,
But they use something, they say milk, bottle, they say something. They know at least 1 or 2, 3 words. If you're noticing that when they need something, they just cry and you have to figure out what they want, something is wrong. There's something there you need
so
to
they
look
are
into.
frustrated inside.
Exactly.
Okay.
Exactly. And then also you notice that your baby's not looking at you in the eyes. You're playing with your baby and then he's looking elsewhere. He's not keeping eye contact with you.
Okay.
This is something.
Donc, autrement dit, vous get up 2 points là.
Absolutely.
Okay.
Absolutely. You would also notice that your baby doesn't play with others. He prefers, or she prefers, to play by himself. You would notice that he would say, even though he has siblings, I keep saying hey, my apologies, but you understand what I mean? The
Yo pas qu'à connecter effectivement.
Exactly. The child prefers solitary activity. When you notice that, this is also something you need to look into. Don't just overlook it as, oh, they're just shy, or, you know, she's just a baby, or they're just not doing certain things yet. No, look into it. And it is not a personal reflection on the type of parent that you are. Several parents neglect to seek mental health services for their children because they fear that if they diagnose the child with a condition, that it's a personal reflection on them, and it's not.
Or du moins, they'll feel responsible for that or the disease. I don't want to say disease, effectivement, because I really...
It's a condition, yes. We'll say that's a condition. You're not responsible for what nature provides sometimes.
Bon, ça sont bail, on le dit là encore, peut-être pour pas capable de comprendre que un petit monde qui est malade, li gen peut-être li autistique, un petit monde qui pas capable d'intégrer dans la société, ça n'a rien à voir avec ou même en tant que personne.
Absolument.
Et jusqu'à présent, je pas crois que spécialiste dans le domaine là capable pinpoint exactly qui côté maladie ça ressorti, comment on fait rentrer, parce que il y a des gens qui pensaient que nous sommes intégrés en arrière-grand-père tête, il pas fini tellement bien, tout son bail qui est héréditaire, il prend dans race, est-ce que effectivement, toi, en tant que professionnel, tu as fait des études dans ce sens, est-ce qu'on est capable de dire effectivement que un petit monde qui peut-être renfermé sous lui-même, un petit monde qui est capable de faire avec Tourette syndrome, qui est capable de faire avec qui est autistique, est-ce que son bagage qui est héréditaire?
As far as being autistic, we have no way, the science has not yet determined whether it is hereditary. We don't know. Because there's a possibility that no one in the family is autistic, and then here comes your baby. You can also have identical twins, and then one is living under the spectrum and the other one is not. So there are several different cases where we have different irregularities. It could happen under this condition. You would see this, okay, this child is autistic because here's the family setting. And then you would look at another child with completely different family setting, and the child is also autistic. Okay. All we know for sure is what the indicators are. Social skills, eye contact, language development, things like that. Now, autism is not synonymous to a learning disability or an intellectual disability.
Okay.
Several children who are living under the spectrum are gifted.
Highly functional.
Highly functional.
Yeah.
You would notice these children sitting there doing puzzles and learning 3 languages, and they have a gifted IQ. Okay. And at the same time, you would find others who are lower performers. So it's not synonymous to an intellectual disability. So several parents, when we tell their kids they're autistic, they would say to me, "Boli pa égalé."
Donc, autrement dit, de petit monde autistique, donc son petit monde qui a un problème pour l'apprendre, qui pas capable effectivement apprendre, alors que il pas vraiment connaît que petit monde il doit dans 2 pôles différents dans autistique là. So, c'est sûr que il y a des parents qui vaut mieux qui comprendre, qui accepter que vaut mieux que les high functional plutôt que son petit monde qui pas capable. Maintenant, parlez-nous un peu de petit monde ça. Est-ce que vous avez des parents, par exemple, dans le domaine où tu travailles également à Mamie Dédé, est-ce que vous sentez que vous avez des parents, petit monde ça, qui ont des difficultés pour apprendre? Est-ce que vous avez cherché professional help, juste pour aider petit monde ça?
This is the one thing I am very disappointed with my Haitian community, is that they do not accept any form of diagnosis. Well, I apologize. I'm not generalizing. Some are more responsive to treatment, but a large majority is not responsive to treatment. We would tell them that, okay, this is the reason why your child behaves a certain way or learns a certain way or is not performing the way they're supposed to for their age. And I always get the $64 million answer. Oh no, c'est ton ma tante li qui te fait ça.
Whoa. Hold on. Répétez ça, dire. C'est son monde qui fait.
Ils te font rêve, et puis ils te ouais. Ma tante là te font signe de la croix sur tête li depuis les elle lever dans demain petite la fou. And here's another word. Don't use that word.
Donc, où je une réponse à effectivement.
Yes. These are real case scenarios. Yes.
So they're still in denial ou quoi est-ce que vous sentez que c'est connaissance tant que vous pas gagné là-dedans?
Well, of course, culturally, we are prone to believe that mental health disorders are supernatural issues. Of course, culturally, many Haitian. When was the last time you met someone who told you, you know, so-and-so passed away yesterday? Subitement.
Yeah.
Manger. Right? So this is something, it's becoming second nature for us.
Même là, on fait 30 ans, pas jamais mon médecin. Mon a mouru, and then boom, c'est manger. But ou gen 30 ans, pas jamais font check-up, at least, pour connaître, est-ce qu'on pas gagne des maladies qui cachent là-dedans. It's the same way pour ti moun sa qui souffre de bagages. So, continue. Rachelle, regardez, alors, dis-moi, assez intéressant, il me pense que le public la content en pile, de travail ça qu'a fait là en ce sens. Et, par exemple, est-ce que, aux jeunes, gen des ti moun, effectivement, dans l'école, soit gen parents qui viennent jouer nous, mais on sentit que, si moun n'est pas normal, ça nous même pas dans le langage pas nous dit le fou. Parce que gen qui
such an ugly word.
Yeah, gen ti moun qui toujours a parler ensemble avec on l'autre ti moun, so there's an imaginary friends, right? Talk to us about that.
Imaginary friends are not bad up to a certain age. We all had an imaginary friend. You may not have remembered yours.
Or maybe I don't want to talk too much.
But almost every child has an imaginary friend. This is a sign of creativity, right?
Okay.
But if your child is 12 and he has a little imaginary friend here on this side, little red guy here and a little different color guy here, you need to look into this.
Peut-être job too, hein?
Bon, of course, I have to say job.
Okay. But c'est sérieux ça, hein?
Yes, very serious. The reason I think autism spectrum disorder is a very important topic for our community, I noticed that this is the diagnosis that our community have the hardest time accepting. Okay, it's prevalent. A lot of twins tend to have to be living under the spectrum, and I don't know how much of a Haitian you are, but twins are supernatural beings in our community, right?
That's true.
And of course, if one twin is normal is not a thing. No one is actually normal, right? But we'll use this term loosely today. So if this is meeting, so let's use the scientific term. If one twin is meeting developmental goals the way they're expected to, but the other one isn't, and then the other one is autistic, of course, my Haitian parents tell me that c'est l'autre marasa qui marel.
Ça sont même m'attendais mots ça depuis Haïti. L'autre marasa qui marel.
I've heard it here.
Even here.
And I would tell them, no, mommy, this child is living under the spectrum because here are some developmental difficulties that this child is experiencing, even though your identical twin is not experiencing.
Rachelle, what can you do in that sense to help these parents? What do you say to them?
I have to educate
whether they want to like it, they want to listen to you or not, or they want to hear what you have to say. Is it always easy to communicate to these parents and to tell them the truth? This is what's going on.
I have been lucky because I have a personal story. I have a set of identical twins living under the spectrum. And I find that when I share this personal experience with them.
So you open up to them.
Yes.
So, okay, you're not alone in this. I'm myself battling with this as well. Okay, I want to hear that. Okay, what? Comment répondre?
So I would say, mommy, guess what? Moi-même tout, moi j'ai deux petits moun qui ont même difficulté. Et puis, mais qui ça me fait pour eux? Okay, and I have to pull up the cell phone and show pictures so that they know that those twins actually exist.
So they can actually believe you. Yeah.
So they can actually believe me. And I said, but here's what I did to help them do well.
How old are they now?
They're 13.
13 already.
13 years old. Yes.
Wow, that's awesome.
Yes. And they're doing well. They've had speech and language therapies. They've had anxiety disorders therapies. A lot
Both of them or just one of them?
Both of them.
Both of them.
One more so than the other.
Okay.
Right? So I had to share a personal story with these parents so that they can understand you're not alone. And I don't have an auntie who's eating my twins. I don't have an uncle who's m'embalène quelque part pour mes enfants. D'accord? Donc, je sais que c'est un problème. Comme vous, en tant qu'un nouveau parent, je n'avais pas su l'importance de early intervention.
Okay.
But as soon as I noticed that, my kids are a little different, right? I was in denial just like you because it's your baby. There's nothing wrong with them. They're perfect.
Yeah, they might because I'm okay.
Exactly.
I'm okay. Why not? Why not my kids? But listen, that's a lot of courage, Rachelle. Ou gen tout courage ça, but again, parlons si j'en sorti hors du sujet, juste parce qu'on rentre là-dedans. Le courage, c'est à admirer également. Et est-ce que ça a un rapport avec le fait que you are private, right? You're a soldier.
Yes.
Parlez-nous un peu de ça. Not a private?
Oh, no. I retired in the United States Army as a second lieutenant. Last year was my last year of service.
Really?
Officially
so you're no longer going on weekends no more?
No
so
more.
You're good?
I'm good.
How was it, that experience?
It was very difficult as an adult when you're trying to keep up with 18-year-olds and 19-year-olds.
Yeah, because I remember you were not 18 when you joined the army.
Yeah,
you
I'm not going to say how old I was. I was nowhere near 18.
Okay.
But, hey, I did what I was supposed to.
Mais, again, n'a besoin de la communauté, peut-être que tu vas m'envoyer des photos pour nous capable montrer, parce que en quel monde parle quoi que, listen, I have actually a soldier. You were in the army and then you were in Africa, in Europe, maybe all over the world, right? So how was it your experience in the army? Est-ce que son bail ou recommander un pilote jeune pour faire expérience ça? Parce que même tu étais déjà maman. Et on fait presque 2 ans abroad. So how was it?
It was the hardest thing I've ever done.
Would you do it again?
I would do it again because of the mental control that I've earned from the experience.
Okay.
And the resiliency that I've acquired through this experience. Now, I'm not going to say everyone should try it because it's not given to everyone. We all made differently. Some people can handle the stress and others cannot. And
what did you do to handle that stress?
My faith. My faith played a major role in how I manage my everyday stress, how I manage the stressors that the job brought to me, leaving my kids behind for almost 2 years.
Yeah.
While I
that was probably the hardest part,
Absolutely.
right?
Absolutely.
So was it easy for you to, I know in the army, sometimes it's difficult for a woman to be accepted. Was it the same way for you? Were you accepted from the get-go? I
was never accepted because I'm a minority twice. I'm a woman and I'm Black. Oh, I'm a minority 3 times. English is not my first language. I forgot about that.
Exactly.
I'm a foreigner, minority, and a woman. In addition to that, because I joined the army with a degree, then I didn't get to be a private. I got a higher rank. And those who were there years before me, they didn't enjoy calling me by that rank because they felt that they have more experience than me, and therefore I didn't deserve this title that the army bestowed upon me. But I earned it because outside the army, they didn't feel that it was warranted since I didn't acquire that experience inside the army. I
don't know if you're going to answer that question or if you can answer that question. So, certain things, in this country, you might want to say, but Shannon, I'm not going to answer that one. Did you ever experience some racial slur while you were in there?
Absolutely.
Really?
Absolutely.
Why? Because you were Black or just because you were a woman?
Both.
Both of them.
Yes,
and est-ce que il y a une commission qu'on capable dire ou capable porter plainte et sous porter plainte qui ça vous fait pour ça?
You can complain all you want, but one thing I learned as a psychologist and as a mental health person is that you don't have to react to everything.
Mm-hmm.
So go and report, and then what? Then I open a can of worms.
Yeah.
So I'm targeted now because I don't have thick skin, or I'm not this one. Of course, the Army provides an open door policy where you can go and report anyone who's bullying you.
Mm-hmm.
But let's just say that I was focused on the higher, more important things. That was not my focus. You can call me names all you want, but you still have to say officer and then the name behind it, whichever name you choose to.
But I can only imagine, Rachelle. So let's say you're all the way in the other end of the world, and then you have this, and you're by yourself.
Mm-hmm.
You have nobody in the army, and and then pour subi tout bagay ça. So I think it was tough for you, and you did it though.
But I survived. I sure did.
And that's why. And peut-être ou capable dire ti moun yo kap tande nou la fait expérience ça. Est-ce que vous pensez que dans le moment que nous vivons là, the way that the world is going, and then influence que pays ça que nous vivons là dans le gain à travers le monde, est-ce que vous pensez que c'est une bonne idée pour
It has to mean something to you. Okay. You cannot just do it just because someone told you to do it. It has to mean something to you. I joined the services because it meant something to me. This was my way of giving back to a country that's given me everything.
Mm-hmm.
So it has to mean something to you.
Mm-hmm.
That's what I would say. If it means something to you and it's important enough for you to feel that, you know what, I want to try this, I want to do this, you better get ready because you'll get lashes left and right.
Wow. Thank you. Merci Rachelle de ce que vous partagez ça ensemble avec nous. On a observé petite pause tout petit encore. Et puis on a retourné pour la dernière partie de cette émission. Madame, monsieur, une pause, à tout de suite. Madame, monsieur, nous sommes donc de retour pour la troisième et dernière partie de l'émission d'aujourd'hui. Je vous le rappelle, notre invité d'aujourd'hui, c'est Rachelle, un psychologue, un monde qui travaille dans le domaine éducation par bord ici, professeur, et il y a un private practice qu'on y a là, et dans la dernière partie, Rachelle parle de nous, effectivement, si toutefois nous avons besoin d'aide, comment pour nous faire pour nous être capables de contacter lui, si nous avons des amis ou encore si nous avons qui gagnent difficulté ça. Alors, Rachelle, learning disability, nous font bon petit chita parler sur lui, nous parler tout de comment pour identifier Timon Sao de très jeune âge, depuis dans 18 mois même, pour capable remarquer si toutefois Timon a un problème.
Yes.
So, dans la dernière partie, on a fait un petit résumé bien avant que pour nous, qui ça pour nous faire pour nous capables aider parents ça.
Absolument. Donc, you send your child to school and the teacher is making certain observations, okay? And the teacher is telling you, well, he's not quite learning, he's not making progress. And every time you have a meeting, the meeting is not quite positive. You need a psychologist. Call me. Or your 2-year-old or your 3-year-old is going to Head Start or they started pre-K. Don't think that, oh, they have time, they're still young. No, if you're teaching them something and they're not picking it up, you need to call me. You need to find a good psychologist, whether it's me or someone else that you trust. Okay. You need to find one and have them do an evaluation for your child. Prevention is key. Maybe you think there's nothing wrong. That's fine. Do the evaluation. And if nothing is wrong, then good. Better that you did the evaluation and you find out that everything is fine rather than ignoring it. And then when it's too late, your child is already in middle school. Now you're being forced to do intervention and that child has already lost so much already.
OK. On parlait de Timon, par exemple, qui gagnait IEP.
OK.
Vous connaissez des fois dans l'école, Timon a gagné un IEP. Timon Sao gagne une série de modalités que le professeur est obligé de suivre pour être capable de travailler ensemble avec Timon Sao. So, qui différence qu'on fait ensemble avec Timon qui gagne, par exemple, un IEP dans l'école là, ensemble avec Timon qui gagne really those learning disabilities? Do they also have IEPs for Timon qui gagne those learning disabilities?
So usually children with an IEP have some kind of academic disorders, some kind of academic disability.
Whether it's severe or not.
Exactly.
Okay.
If it's severe enough, you get an IEP. If it's mild and the child can somewhat function, but only needs certain accommodations,
The
at that
504?
point you request a 504,
A 504.
plan
Okay.
for your student. Okay?
Okay.
So those terms we're using, IEPs and 504. An IEP is an individualized educational plan.
Right.
When you have a student who's struggling with learning in the classroom, your school team will have a meeting with you and they will explain how the school is going to be assisting your child so that they can make progress. The 504 accommodation plan, and these are all protected by the federal government. If your child needs the service, the school is required to provide the service. And when you go to these meetings, if your English is limited, do not go to these meetings not understanding what they're asking you to sign, okay, because you're making major decisions on your child's life. If you fear that you may not understand everything that they're conveying to you, please bring someone with you. You are allowed by law to bring whoever you want.
Or can they request a translator at the school?
You can request a translator at the school if you need one, but I'm not only talking about a translator, because a translator is just going to translate stuff to you that you still don't understand anyway.
That's true. Mhm.
You need someone who's going to be there with you and explain to you what exactly are they going to provide for your child. What was your child diagnosed with? That's what you need someone to help you with.
OK. Alors, Rachel, on va terminer rapidement. Si toutefois on t'a besoin de contacter, comment puis t'as fait pour contacter? C'est sûr que vous n'allez pas m'appeler, hein. Je suis pas psychologue. Alors, c'est Rachel.
I have a private practice in Palm Beach County, but I also operate in Miami-Dade County. If you need me, my cell number is 786-200-1362.
Do you have an email or something?
Yes. Moralisa Learning Center at gmail.com. My private practice is Moralisa Educational Services. We do all of those, we provide all of the services that we discussed during this meeting today. I do all the evaluations. And if your child does not speak English, ta-da, I can also evaluate them in the language that they are comfortable with, whether it is French, whether it is Creole. Okay. Once again, my practice is in Lake Worth, Palm Beach County. But if it's too far for you and you need me to meet you in Miami, I can do that also. Just give me a call and let me know, and then we'll make an appointment.
So that means there's still hope, Rachel. Remember, when you diagnose as early as possible, right?
It's not a death sentence. Yes, it is not a death sentence. Thank
so
you.
So there's nothing to worry about. So si toutefois senti que ou gen ti moun ki la ka ou ki gen difficulté sa ou,
absolutely,
just seek for professional help.
Just seek help.
Right?
Do not just leave them there and treat them as though their life is over because they have a disability. If they tell you that your child is diagnosed with something, continue with your therapies, continue receiving services. Do not neglect the child because you fear that, oh, they pas venir en pita, c'est pas vrai. With the proper therapy, they can function.
C'est stigma, peut-être il y a des parents qui pas fin tellement remen, stigmatisé.
The label.
Yeah, the label. I mean, the label que vous mettez sur timon yo.
The reason we give your child a label is so you can understand what they are living with, so that you can better interact with them. If you understand your child and you understand their difficulties, then it makes more sense to you and you're less frustrated when you have to deal with the child.
Un dernier mot, un conseil pour parents qui vivent avec Timon Sao qui sentent que à bout. You know, it's so difficult to live with kids with certain disabilities. So what can you say to them to help them?
If you have a child with a disability, as a parent, this can be very overwhelming. Seek help for yourself. There's nothing wrong with you getting the help of a mental health service also. Mental health services is not only if you have an intellectual disability or depression or anything like that. Counseling can help you cope with certain difficulties in your life also. They also have parent management training that you can go to help you understand your child better and reduce the stress that comes with helping and raising a child with a disability.
Ouais. Rachel, encore une fois, merci d'avoir accepté l'invitation.
Absolutely.
Thanks for coming. Thanks again. Et peut-être on va retourner en l'autre encore, pourquoi pas?
Absolutely.
All right. Yes. Alors, si toutefois, viewers yo, parents yo, monde qui gagne un problème ça yo besoin beaucoup plus de détails, yo capable d'écrire non à FaceaFacecreation@gmail.com ou encore aller sur YouTube channel nous, abonner parce que nous venons avec plusieurs émissions comme ça. Un remerciement spécial à Capri Arts, à Peacock Photography et également à Alex Salon Graphic and Design. Alors, si nous gagnons tout problème graphique, nous sommes capables de contacter monsieur, nous sommes capables de contacter Capri Arts, qui c'est major sponsor chose ça que nous avons gardé là. Encore une fois, madame, monsieur, merci de votre fidélité, votre patience. Et merci pour mots d'encouragement que nous gagnons. Des mots d'encouragement, c'est sûr que tu vas recevoir beaucoup d'encouragement à partir de ce show. Rachel, mon nom, Alain Sanon, c'était Face à Face. À la prochaine, madame, monsieur.